morning, doctor. بەڵێ گوێمان دێتە.
باش ئەم کاتتان باش هیوادارم باش بن. بوو بورە دوێنێ ئەم هینەم تۆزە درەنگ بۆتان نارد. هیوادارم زۆر بەتان هات بێتن. وابزانم هەمووتان دەرسم پێوتون، هەمووتانم ناسن وایە؟ یارە لاڤین؟
بەڵێ دکتۆر خۆیەتی.
Okay, bash. Okay, we start quickly. I hope this situation resolve as soon as possible. هینێکی ناخۆشم ئۆنلاین و شتانە چکە بەعزێ کەس مشکلی هەیە بۆی ناکرێ. Okay, we will quickly start radiographic pathology. ئەگەر هەر کەسێک گوێی لێم نەبوو یان پرسیار بکە یەکسەر قسە بکە بێ زەحمەت. The first lecture it will be just few important definitions of the terms that and phrases we use in pathology in general. So we go straight to the slide number 6, and we talk about. There is 1 second, sorry. So, I thought, we talk about pathology. Sorry for the background noise. One second, let me change my. Jamal, 1 second, I will be back in 10 seconds. With the study of the causes of the diseases. سببي نخوشيكا چیه؟ Etiology, study the causes of the disease. So this might come up, for example, as definition again, or as true and false. So pathogenesis is we study how a bacteria or a virus cause diseases in our body. So pathogenesis. What's happened when a bacteria goes inside human body? What are the changes that happen after we get infected? So this is pathogenesis. لهر شوێنێکە ویستان پرسیارم لێ بکەن at any time you can stop me and talk immediately. So we have the changes. What are the changes that happens inside the human body during diseases, during pathology? On cellular levels, we have something called cellular adaptation. So what happens, for example, when you get a flu, when you have a flu, what's happened on the cellular levels? What happened inside the cells? There are few changes that happen. As a general term, either the cells get smaller in size. I don't know if you can see it in the images, the lower images. During any injury, either the cells get smaller in the size, which we call it atrophy. You see the word atrophy in the image. Or the cells, they get larger in size, we call it hypertrophy, or sometimes they get larger in number, we call it hyperplasia. And sometimes we have something called metaplasia. So these are the changes that happens on cellular levels in any diseases. يعني أمقوران كاريانا الرواية للسيلة لخانية. And atrophy, hypertrophy, hyperplasia, and metaplasia. So this has something to do with the morphology, yes? With the shapes of the cells. Okay. We have something else called carcinoma. I am sure all of you know by now what do we mean by carcinoma. جماعة ديك دقة داويلي بكنا كم باجوابيكي أم تلفون ضرورة بموابورا. Sorry. Okay. So you all should know what do we mean by carcinoma, saratan, sherpanja. So we are talking about malignancy, which is a cancer. This is abnormal cell. We have a lot of patients, you know, here with different types of carcinoma. And carcinoma, we have a benign tumor and malignant tumor. And the only difference between a benign tumor and malignant tumor is that the malignant tumor, they have the ability to spread inside the human body. While benign tumor, they don't spread. And this is very important, it's very significant. This makes a huge difference when it comes to the treatment of the patient. يعني فرق كلش اكو فرق كلش مهم يعني بين سرطان السرطانات الحميدة والخبيثة أو بعربي يعني بين malignant و benign فرقێکی زۆرە. ئەگەر تیومەرێک malignant بێ نەخۆشەکە مثلا احتمالی مردنی زۆرترە. They have high mortality rate, they have high morbidity rate. They need a lot of year of treatment sometime. while benign tumor, some of them, they don't need anything. So carcinoma is a malignant tumor, but benign tumor can null carcinoma. أما زور جالانه but true false بيتو. Sometimes it might come as true false. So you have to differentiate between carcinoma, benign tumor, and malignant tumor. If the tumor arises from most of the cancers arise from the epithelium, from epithelial cell, as mentioned here. If you read the carcinoma definition, is a malignant growth that develop from the epithelial tissue. So if the tumor arises from this cell, epithelial cell, we call them carcinoma. But if the malignant tumor arises from the connective tissue, we call it sarcoma. So both carcinoma and sarcoma are malignant tumor, but the difference is the cell of origin is different. The first one is epithelial cell, the second one is connective tissue. If you want to know the difference between epithelial cell and connective tissue cell, you can go and read it. نازم قدسي anatomy بيوتم بيتن أتوانم شن فرق كيف بخنو ويبزانن كألين ساركوما يعني شي كألين كارسينوما يعني شي. Most of the malignant tumor of human beings are carcinomas. Carcinomas are much commoner than sarcoma. Congenital is the disease that exists from birth. يعني منالك لديك به تشخيص يكن نخوشيك هي. After birth, we have a lot of babies. Immediately they diagnose them with something. This is a congenital disease. Congenital disease. We have a lot of examples here in this photos. Congenital diseases of the heart, like for example, coarctation of the aorta or patent ductus arteriosus. يعني أمانها ميلا كاتي منالية تشخيص أكرين. We diagnose them very early after birth. So this is congenital. Now we have something called hereditary. When we say hereditary, it means that it comes down from the parents. It comes down, the disease passes through the genes. So what is the difference between congenital and hereditary? وطبعا hereditaryش هلا كاتي أدوية دايقونه هيو congenital و hereditary. If someone can tell me what is the difference, read both the definition. What is the difference between congenital and hereditary? Okay. The reason I ask you this question is just for you to wait at slightly at this two definition, because this is very important. I knew that probably no one will answer, but it's very important because a lot of students mix between the word. If a disease is hereditary, it means it has to come down through genes, through chromosomes, from the parents to the child. But the congenital ones, it's not necessarily coming down from the genes. It might be a problem, for example, developed in the baby when the baby is inside the mother uterus. كەوتمان هێریدیتەری معنای ئەوەیە لە کرۆمۆسۆمەوە گواسراوەتەوە لە جینەوە گواسراوەتەوە نەخۆشیەکە بەس کۆنجێنیتاڵ شەرط نییە لە جینەوە گواسرابێتەوە لەوانەیە مشکلەیەک بێ لە کاتی دروستبوونی مناڵەکەیە لە سکی دایکیا دروست بوو بێ مەسەرەن مناڵ دایکە بێت دوو پەنجەی نییە لەوانەیە زۆر جاری لاقی نەبێ بە وراثەوە لە جینە نییە سوتفەکە لە سکی دایکیا دروستە بێ ئەو دوو پەنجەیە دروست نابێ ئەمە کۆنجێنیتاڵە باشە لەبرەوە فەرقەکە ئەوەیە is very important. It might come up in the true false section. I might say congenital diseases pass through genes, necessarily pass through genes from parents to the baby. Immediately you have to say false. Please don't mix these two. And one of them probably they have a good chance to come up in the exam. Now we have something called idiopathic. When we don't know something, it's idiopathic. When we have a disease that we don't know the cause, and there are a lot of diseases that we don't know their causes, we call them idiopathic. Like we say idiopathic something. It doesn't mean that there is no causes for the problem. There must be a cause, but we still don't know them. We have not discovered them. So this is idiopathic. So just remember the image. So when we say idiopathic, it means that we don't know yet. These are all medical terms that you have to be familiar with. Now, there is this two terms that is always been mixed. This is infection and inflammation. بكرديا بعربي هرالين التهاب. But it's very important you know the difference between infection and inflammation. Whenever we say the word infection, it means that there should be bacteria or virus going inside the body, or fungi or parasite. So this is infection, something goes inside the body. But inflammation is a response of our body to the outer infection, to the injury, to anything. For example, coronavirus is an infection. Typhoid fever is an infection. Flu virus is an infection. But what's happened inside our body, the symptom we feel after these infection is the inflammation. Is because of the inflammation. Inflammation happens for other reason other than infection. Like if someone, for example, knock you on the eye, أقريك بوكس بالا تشاو باوس يعني. أو inflammation كاتا inflammation بس با infection رونايا. We have 5 main symptoms, 5 cardinal signs of inflammation. What do we mean by that? In any inflammations, there are 5 signs that we see. 5 signs that we see during inflammation. Just remember someone like when someone hit you on the face very hardly and you get a hit you here on this eye, you feel pain afterward, and then the area become red and then you cannot open your eye because of swelling, and then this area become more, you feel more heat in this area compared to this area, and then you cannot open your eye, loss of function. So these five are the signs of inflammation, so remember them, please. These signs happen during inflammation. When someone hit themselves with a hammer on the nail یەکێ چەکچەکێشە بەنینۆکە چی ڕوایە ئێش شوێنەکەی دوایی سوورە بێتەوە ئاوسێ دەسی لێ و شوێنە گەرمترە دەوروبەری ئەنجا ناتوانێت بە پەنجە هیچ بکات. Loss of function. So these are the signs of inflammation. تا ئێستا گوێتان لێ بە جەماعەت؟ یوسر هاتووە یوسر نهاتووە؟ Okay. Okay, the next one is iatrogenic. So anything happens to any patients in a hospital, for example, any injury, any harmful thing happened to the patients because of us, me and you, or someone working in a hospital called iatrogenic. For example, بۆ نمونە تۆ ڕادیۆگرافەری نەخۆشەکە خەیتە سەر بێدەکە بۆی ئەکسرەیەک بگرێ ئەگەر بکرێتە خوارەوە لەو کاتەیە توش مەسەلەن شوێنێکی پشکێ ئەوە iatrogenic injury. So what do we mean by that? Like someone, if for example you go to a nurse to give you an injection, a needle injection, and if the needle during this procedure broken inside your skin, this is an injury. This is iatrogenic injury. Now, another very important term is metastasis. What do we mean by metastasis? We talked about carcinoma and the ability to spread to distant places. سەرەتان شێرپەنجە ئەچێ بۆ شوێنی دوور لە شوێنێک و دروسە بێ و بڵاوە بێتەوە. ئەو بڵاوبوونەوەیە پێوترێن metastasis. So this spread of cancer, the spread of cancer from its original place to a distant place in human body, we call metastasis. And this is the reason why cancer patients dies because of this metastasis. If we have two patients, both of them have the same cancer, but this one has, the first one have the cancer that does not spread. The second one has the same cancer, but is spread to a distant place. This is stage 1 cancer, and the treatment might be very easy, while the one that have distant spread is stage 4, and they might die in 2 months. So it's very important to know if the patient have metastasis or no. For example, بۆ نمونە, when a patient comes to me with a cancer in his colon, with colon cancer, the first thing I do is do CT scan for them, because CT scan show different distant spread metastasis. Colon cancer هەیە ئەبێ CT بۆ بکەم بۆ chest و بۆ abdomini بزانم کانسەرەکە ڕۆیشتۆ بۆ شوێنیکە. If the CT tell me that everything is clear, it means the cancer is in stage 1, and the treatment is very easy. But if the CT scan tell me that there are cancers in the liver and the lungs, it means this is stage 4, and the treatment is very difficult. So it's very important. Please remember metastasis. We have something called TNM system. This is usually we use for colon cancer. The TNM is short for tumor node and metastasis. You have to know this TNM system, please. This is the way of classification of the tumors. So in the T, we know the tumor size. In the node, we know how many lymph nodes involved, and M for metastasis. So if we have a patient, for this is just an example. If we have a patient, we say his T0, N0, T1, N0, M0, it means you have a small tumor with no lymph nodes and no metastasis. If we say the M is 1, it means the patient have metastasis. Okay, so just imagine one thing. For example, if we talk about lung cancer, we have many different types of lung cancer with different names, different origin. Some of them, they are very aggressive. Some cancers of the lung, they are very aggressive. When the patient is diagnosed, after diagnosis, they might die in 1 month. While some other types of the cancers of lungs, they are not so very aggressive. When we diagnose them, even we don't give them treatment for 1 year, they still can survive. This is depends on the types of cancer. And we have something to differentiate between the power of the cancers, how powerful the cancer is. We call them grading. So some cancers are grade 1. It means they are not very powerful. They are still cancer, but they are not very powerful. They don't kill people as fast as the cancers in grade 4. يعني أو كانسراني grade 4 زياتر خلقة كوجن وكل grade 1. So you have to know the grades. You have to know, like, grade 1 is well differentiated. We call it well differentiated cancer. Grade 2 is moderately differentiated, and so. So it's very important. I said many times before, one problem that most of the students face problem in the exam is the English language. For example, in grade 2, the name is moderately differentiated. When you face a word or a phrase which is difficult to pronounce, or you don't know the name, you forget very easily. So my advice to you is, for example, moderately differentiated. If you go later and for 1 second and put it in Google to see the meaning of what, if you don't know the meaning. When we say moderately differentiated, put it in Google, understand the meaning, and listen to Google how it pronounce it. This is make it easier for you, because the word that you cannot understand and you cannot read, you forget very easily. Now, so how the cancer spread in the body, how the metastasis happen. For example, someone have a cancer in the colon, how the cancer go from the colon to the liver, for example, to somewhere else. So we have different ways of this. The first one is direct invasion. What do we mean by that? We have the cancer in the colon, and if we leave it for enough time, it slightly gets larger and larger and get outside the walls of the colon and spreads in the surrounding area. This is a direct invasion. The other one is, sorry again about the background noise. The other one is lymphatic spread. You know, we have a blood vascular system and we have lymphatic system. So around any organ in the body, we have lymph node, gray lymphatic. So the first place any cancer goes is to the surrounding lymph node. So we call it lymphatic spread. The cancer goes through the lymph. Sorry, let's this noise finish. Jamaat, sorry about this. So then we have hematogenous spread. So this is where the cancer goes transferred or transported through the blood system. Again, the colon cancer can go to the liver, can spread to the liver. How it spread from the colon to the liver? Through the blood system. So this is hematogenous spread. And this is the most important way of spread of cancer. And then we have implantation. This has happened, for example, if I operate on this patient with the colon cancer, during the surgery, if I manipulate the cancer and move it around, I can implant the cancer somewhere else in the abdominal wall or somewhere else. لكاتي عمليات كمان عمليات البوكا colon cancer لعبة لوانية بدستو لكاتي ليا كردنوية during excision I might implant the cancer cell somewhere else. And then we have something called transcoilomic spread. You have to know the difference between these. If you look at this slide and on the right hand side, there are a few things mentioned: Krukenberg syndrome, systematic Jaws nodule, malignant ascites, and Bloomer shell. These are all types, all examples of transcoilomic spread. Transcoilomic is very easy for you to forget this phrase. Please, you can have a look at the meaning in Google. Now, do anyone have any questions so far? كسبرسيالي هي جماعة سهند لافين ليرن.
بلا دكتور ليرين.
Okay, then we have something called apoptosis. Yesterday I had a lecture with another group. I think it was pathophysiology in optometry. I have mentioned this apoptosis for them. This is a very important thing. For some reason, they like this word, and it come up in the exam a lot of times. So apoptosis is something physiological. It's not pathology. It's not pathological. So apoptosis is a good process. It's not a harmful process. So if in the exam I say apoptosis benefit human beings, the answer is true. So this is, if you think about all our cells, they all have a certain lifespan. Like, for example, the red blood cell, they live for around 120 days. After that, they dies. Who killed them? This apoptosis. The old red blood cell, they should die because they cannot function. They are very old. They should go away to make the space for new red blood cell to come and function. So who kills the old cells? This apoptosis, or we call them as programmed cell death. So if you have a problem with your apoptosis, what's happened is you get cancer. کەواتە ئەگەر ئەپۆپتۆسس ئیژ نەکا سێڵە پیرەکان نامرن ئەبن بە کانسەر. So one reason we get cancer is because the apoptosis is not function normally. So this is a very good thing that this programmed cell death is a procedure, is a physiological procedure in the human body. Now, we go through the rest quickly. When we say ischemia, whenever we say ischemia, this is where there is not enough blood, a normal blood amount going to an organ. For example, when we say the patient has an ischemia in this heart, it means that the heart doesn't get enough blood. We have a term, we see a lot of patients in hospital with limb, with arm or leg ischemia. It means the artery that take blood is blocked and doesn't get this limb, the leg doesn't get enough blood. So what's happened is ischemia in this leg. So diagnosis means تشخيص دیاریکردنی نەخۆشی. Diagnosis this is how we find diseases, we identify the diseases. So this is diagnosis. And we have symptom and sign. If I am a patient, I come to you. If I tell you I have a headache, سرمێشە, this is a symptom. When you examine me, if you see a small lesion here during examination, this is a sign. So what the patients tell me, the symptoms, what he or she complain of are the symptoms. But when the thing that I find in the patient during the examination is the sign, For another example, a patient have itching his back, this is a symptom. You see a lot of small blisters, small lesions. These are signs. So please don't mix between symptom and sign. Nosocomial, anything has to do with hospital, we call them nosocomial. For example, we have nosocomial infection. ئەو نەخۆشانی کە لە خستخانە داغڵەبن بۆ نمونە لە عینایە داغڵەبن لە ICU بۆ مانگێک دوای هەفتەی 2 هەفتە تووشی ئینفێکشن ئەبن لە عینایەوە ڤایرۆسەکەی وەرگرتووە. So the patient in ICU, for example, a patient stay in ICU for 1 month. After a week or 2, he developed an infection, a bacterial infection he picked up from the ICU. So we call them, this is hospital-acquired infection or nosocomial. So metabolism is the sum of all physical and chemical processes in the body. You have to memorize this. You already know the disease, but if it come up as a definition, you have to write what's written here or any meaning of this. شرطني أو بنوسي أما بخوين روا. Try to understand what the disease is, and even if you write the answer with your own word, it's still correct. So we have something called syndrome. This is a group of sign and symptom together. Group of sign and symptom together. And we have prognosis. So just let's go back to the previous slide. This is, we said that diagnosis, تشخيصي نخوشية, diagnosis. And then we have prognosis. This is the predicted course and outcome of a disease. What do we mean by this? If someone have a cancer, the prognosis is not very good. أقول هيك السرطان يبي prognosis كي زور باجنيا. If someone has viral infection, a normal flu infection, the prognosis is good. چاوەڕی چێکەی لە نەخۆشەکە. What do you expect? ئەگەر یەکێ کانسەری هەبێ ئەڵێ على لەکسەر ئاوتکەمەکەی خراپە. ئەگەر یەکێ هەڵامەتیە بێ prognosەکەی باشترە. So the prognosis is what we think about the disease. What are the predicted course? So cancer has bad prognosis. Flu, halamat has a very good prognosis. Now, in human genetics, just remember that we have around 3 billion DNA base. We have 23 pairs of chromosome. أنا بزهن بيشتسي chromosome مام here. And just remember that we have two the way of mapping of human genome, which is physical map and genetic map. Physical map and genetic map. Just أودوانا بزهن كأونا chromosome من here. So, tumor, we already talked about this. When we say someone has a tumor, it means there is an abnormal growth. Tumor, it can be either benign, as we mentioned, or malignant. سرطان حميد لو خبيث. So any abnormal growth, we call it tumor. So the tumor not necessarily is a cancer. كشتك tumor بو شرنية cancer بيه. يعني benign lesion بيه. So we have benign, B-E-N-I-G-N, benign tumor, and we have malignant. Malignant شرپنجه, benign شرپنجه. So a lot of time we take biopsies. For example, one of the common diseases is breast cancer. Sometimes we take biopsies. We take a piece from the tumor for investigation. If someone have a colon tumor and they do colonoscopy for them, during the colonoscopy, they take biopsy to know if this is cancer or not, what kind of cancer it is. So the biopsy, so we remove part of the tumor, part of this tissue for investigation. So this is biopsy. And we have aneurysm. So look at the image and you will remember aneurysm. Aneurysm. This is the blood vessel, and you see this is abnormal dilatation. So when we have abnormal dilatation, this is called aneurysm. Why we have to know this? Because there's, for example, aortic aneurysm. When the blood vessel become like this, dilated abnormally, it can be ruptured very easily. بۆچێ بێ ئەنیورزم بزانین لەبەرەوەی ئەم نەخۆشیانە زۆرە خاصەتەن لە خەڵکی پیرە کە تووشی ئەنیوریزمە بن ئەمە ڕەپچەرەکە ئەتەقێت تووشی نەزیفە بن ئەمە ئەنیوریزمە. So one other common disease is renal stone. So calculus means there is a stone either in the kidney or we have stones everywhere in the gallbladder sometime. This is a disease. So calculus means a stone. Necrosis means this black discoloration. So this has happened after cell death. So this is necrosis. جاين شلون سلايد من ماوا أتوين دوائي توايب كين جماعات. إسا أوي كمهمة تائرية للراستيا. أتواني أوي دوائي أوي كماوا دوائي توايب كين وزام شن سلايدي كي كمو بيشتريج خوينو تانا وابزانم أمشتاني كماوا. إسا جماعات هيج برسياريك تان هيا كس هيا بيو اشتيك بلي موا. Does anyone have any questions? Toqa, do you have any question?
No, teacher, thank you.
سهند حتى مهم زام سهند ليري بس ليرانيا الجماعة سكرينكم شير كردبو لقلتانا.
Yes.
Okay. Good. Basha Jamaat, Zor Spas, thank you very much. If you don't have any questions, I will just close the call. Take care.
ببورە دکتۆر عەزەت نەبێ ئێمە جەماعەتی ڕێتێکین هی دەرسەکەی دوێنێ رادیۆگرافی ئەجا دەرسەکەمان بەدەست نەگەیشتووە لەکوێ دەستمان بکەوێت؟
کام دەرسی دوێنێ؟
ئەوەی رادیۆگرافی ئینسترومێشن.
هینەکە وابزانم ئیمان نوێنەرەکەتانە.
بەڵام دکتۆر ئێمە ئەومان لا نییە یا ئیمێڵ ئەومان
یەکێک لەوانە دوێنێ لە بیرم نەبوو ئیمێڵێکی بۆ ناردم دوای هینەکەی بۆ ئەنێرم ئەویش بۆتانە نێرێ وازم یەکێکە لە جەماعەتی خۆتەنیان هەر خۆت بووی
دکتۆر من بۆ من ئیمێڵەکەم بۆ ناردی
کێ سارا؟
بەڵێ
بە ئیمێل بۆ ناردم وایە؟
ئیمێڵم بۆ ناردی وتم لێکچەرەکەم بۆ بنێرە و من شێریەکەم بۆوان چونکە ئیمێڵی هەمویانم لا نەبوو.
باشە بەسەر چاو بۆتە نێرم تۆش وایە نێرە بەسەر چاو.
زۆر سپاس دەستی خۆش بێ دکتۆریان.
Any other question? Okay, take care. بخوافیز.